Good evening, and welcome back to the New York Immigration Coalition Test, Trace, and Take Care video series. My name is Lovely Tejada, the manager of community engagement at the New York Immigration Coalition, and I will be your host. Tonight, I will be presenting on what else we have learned about the virus, how to book an appointment, and why it's still important to regularly get tested for COVID-19, followed by live questions from the audience. You can access our previous content on testing, tracing, and best practices to care for yourself or a loved one with COVID-19 here on our organization's YouTube account. Each video has Spanish, Mandarin, and English subtitles. When a virus is widely circulating in a population and causing many infections, the likelihood of the virus mutating increases. The more opportunities a virus has to spread, the more it replicates, and the more opportunities it has to undergo changes. What we know. Viruses constantly change through mutation, and new variants of a virus are expected to occur over time. Sometimes new variants emerge and disappear. Other times, new variants emerge and persist. Multiple variants of the virus that causes COVID-19 have been documented in the United States and globally during this pandemic. What we don't know. Scientists are working to learn more about these variants, and more studies are needed to understand how widely these new variants have spread and how the disease caused by these new variants differs from the disease caused by other variants that are currently circulating. What does it mean? Public health officials are studying these variants quickly to learn more to control their spread. They want to understand whether the variants spread more easily from person to person. These variants seem to spread more easily and quickly than other variants, which may lead to more cases of COVID-19. An increase in the number of cases will put more strain on healthcare resources. They want to understand whether the variants cause milder or more severe disease in people, are detected by currently available viral tests, respond to medicines currently being used to treat people for COVID-19, and the effectiveness of COVID-19 vaccines. The vaccines are expected to protect against emerging variants detected to date, though the data is preliminary. Scientists are working to learn more about these variants and how they affect the vaccines. Given what we know about COVID-19 and the possibility of getting it again after you've recovered, it's important to continue following prevention measures like repeat testing. Early detection can help stop the spread of the virus to your family and loved ones. If your previous COVID-19 test was negative, you should get another test if you have symptoms of COVID-19, have spent time in large crowds, had contact with someone you think may have COVID-19, live or work in a congregate setting, or are planning to spend time with someone with high risk for severe illness. A viral test checks for a current infection either through nasal swab, oral swab, or saliva sample. If you receive a positive COVID-19 viral test, you should try to isolate. If you get a negative viral test, you do not have COVID-19, but you could get it in the future. Now, rapid tests are a type of viral test. Test results will be available within 24 hours or less of your visit, and COVID-19 tests performed at COVID express testing sites will be free to all New Yorkers, regardless of immigration status. You can now make an appointment for a free rapid COVID-19 virus test at multiple COVID express testing sites throughout the city. The fastest way to make an appointment is to choose a time through the DOHMH online scheduler. For more information, visit the COVID-19 rapid testing webpage on the DOHMH website at nychealthandhospitals.org/COVID-19 testing sites/#rapid. Now, an antibody test checks for a past infection, either through finger prick or blood draw. It takes 1 to 3 weeks for the body to make antibodies. You should get an antibody test if you don't have COVID-19 symptoms, haven't been sick in the last 2 weeks, haven't tested positive for COVID-19 in the last 2 weeks. And if you receive a positive antibody test at some point in the past, including if you never felt sick, you had COVID-19, If you get a negative antibody test, antibodies were not detected, and you likely do not have COVID-19 right now. However, you're not immune from the virus. Free antibody testing is available on a walk-in basis at the 11 acute care facilities of NYC Health and Hospitals and at the Gotham Community Health Center sites. Free walk-up testing is available at the following sites. There's no appointments required. NYC Health and Hospitals operates multiple COVID-19 testing sites throughout the 5 boroughs. The location information can be found on NYC Health and Hospitals website at nychealthandhospitals.org/COVID-19 testing sites. CityMD, through partnership with the New York City government, offers testing at all of its New York City sites on a walk-in basis 7 days per week. Visit CityMD for locations and hours throughout the 5 boroughs at citymd.com. Advantage Care Physicians has partnered with the New York State government to offer testing at 22 sites in New York City. You can visit ACPNY's website for more information at acpny.com. Call the new COVID-19 hotline at 212-COVID-19 or 212-268-4319 to get information about testing sites, advice from medical staff, information about quarantining, mental health support, and more. And to find a testing site near you, you can also text COVID test to 855-48. There is a dashboard community members can use to check estimated wait times at their nearest health and hospitals testing site. The estimated wait times for testing locations are updated by staff every 2 hours. The dashboard can be found on the Health and Hospitals Test and Trace Corps website at nychealthandhospitals.org/test and trace. Many health and hospital sites are reporting little or no wait times. Locations appear in alphabetical order, and they're color-coded by wait time. Vaccines are an important tool in preventing COVID-19. The vaccine is effective at preventing hospitalization and death in people who do get sick. Currently, 2 vaccines are authorized and recommended to prevent COVID-19. The Moderna vaccine is more than 94% effective. It requires 2 doses. The second dose should be taken 1 month or 28 days after the first. With the first dose, you'll acquire 50% immunity, and with both doses, you'll acquire 95% immunity. If your first dose is Moderna, your second dose must be from the same company. The Pfizer vaccine is more than 94% effective. It also requires 2 doses. The second dose should be taken 21 days after the first. And with the first dose, you'll acquire 50% immunity. With the second dose, you'll acquire 95% immunity. If your first dose is Pfizer, your second dose must be from the same company. After a brief pause to investigate 6 reported U.S. cases of rare blood clots, the CDC and FDA have recommended that use of Johnson & Johnson vaccine resume in the United States effective April 23, 2021. The Johnson & Johnson vaccine has been administered to nearly 7 million people in the U.S. The Johnson & Johnson vaccine is more than 66% effective, and it requires 1 dose. You should seek medical attention right away if you have any of the following symptoms after receiving the Johnson & Johnson vaccine: shortness of breath, chest pain, leg swelling, persistent abdominal pain, severe or persistent headaches or blurred vision, easy bruising or tiny blood spots under the skin. And these may not be all the possible side effects of the Johnson & Johnson COVID-19 vaccine. Serious and unexpected effects may occur. The Johnson & Johnson COVID-19 vaccine is still being studied in clinical trials. It's important to know that you cannot get COVID-19 from the vaccine. If you're concerned about getting the vaccine, you should speak to a doctor. The vaccine is free for everyone. If you have insurance, it may be billed, but you will not be charged a copay or another fee. Private and public employees in New York can take up to 4 hours of paid time off for each COVID-19 vaccine shot. Visit the COVID-19 vaccine webpage at nyc.gov/VCC for the latest information on vaccine eligibility and COVID-19 resources. You may be eligible for the COVID-19 vaccine based on a number of factors. If you have an underlying condition, if you belong to one of the eligible employment groups, if you're 16 years of age or older, and if you live or work in New York State. Visit the COVID-19 vaccine webpage at nyc.gov/VCC for the complete list of eligible groups. If you have an underlying condition, no documentation is required. People who are eligible based on their employment must attest that their job requires them to have in-person contact with members of the public or with coworkers, or that they're unable to work remotely. They must also have proof that they work and live in New York State. And proof of work or employment may include one of the following: an employee ID card or badge, a letter from an employer or affiliated organization, a pay stub. And these documents will not be collected or copied by the people working at the vaccination sites. Their only purpose is to confirm your eligibility for the vaccination. If you're eligible for a vaccine based on your age, you must show proof of age and New York residency. You do not need to provide proof of immigration status or have or provide a social security number. Proof of age may include a driver's license or a non-driver ID, ID NYC, birth certificate, current US passport, or valid foreign passport, permanent resident card, certificate of naturalization or citizenship, life insurance policy with a birth date, or marriage certificate with a birth date. Proof of residency may include either one of the following: a state or government issued ID, a statement from a landlord, a current rent receipt or lease or mortgage records, or two of the following: a statement from another person, current mail, or school records. You do not need to share your immigration status to be vaccinated. Getting vaccinated is not a public benefit. The public charge rule has been blocked nationwide. All New Yorkers in need of medical care, food assistance, and other benefits and services should seek the help they need without fear. When you receive the vaccine, your privacy will be protected. There are strict laws in place to ensure confidentiality of your personal information. Visit nyc.gov/vaccine finder to find all locations close by where you can get vaccinated. All appointments must be made in advance. Visit amieligible.covid19vaccine.health.ny.gov or call 833-NYS for VAX or 833-697-4829 for state-run vaccination locations. Visit vaxfornyc.nyc.gov/patient/S or call 877-VAX4NYC or 877-829-4692 for city-run vaccination sites. Find vaccine appointments using the volunteer-operated nycvaccinelist.com. Complete an interest form if you're homebound and would like the city to vaccinate you in your home using forms.cityofnewyork.us/f/homebound. Free transportation is available to senior residents ages 65 and older, and for children and adults ages 16 to 64 with disabilities. If you're eligible, you may be directed to book a free ride after making a vaccine appointment. Passengers can request to be picked up anywhere in the 5 boroughs and taken to any vaccination site within the city. If you're 65 or older, cannot use public or private transportation, and don't have anyone to take you to your vaccination appointment, you can use Access-a-Ride or Medicaid provided transportation and schedule rides as you normally would. If you're 65 or older and do not use Access-a-Ride or Medicaid provided transportation, you can schedule a free ride to your vaccination site. Your appointment confirmation email from city-run sites will include more information on how to secure transport. Before your appointment, you will need to complete the New York State COVID-19 vaccine form found at vaccineform.health.ny.gov in order to get vaccinated. New York State requires the healthcare provider administering the vaccine to check that you completed the form. The form is provided in English, Spanish, Haitian Creole, Russian, Korean, Bengali, and Mandarin. Before you visit a vaccination site, keep the following tips in mind. Reschedule your appointment if you aren't feeling well on the day of your appointment. The CDC recommends against getting the vaccine 14 days before or after any other vaccination. And wear a face covering to your appointment. You will not be allowed into the site without one. Both Moderna and Pfizer vaccines will need 2 shots to get the most protection. The timing between your first and second shots depend on which vaccine you received. You should get your second shot for the Pfizer BioNTech 3 weeks or 21 days after your first shot. For the Moderna, 1 month or 28 days after your first shot. You should get your second shot as close to the recommended 3-week or 1-month interval as possible. You should not get the second dose earlier than the recommended interval. Get the second shot even if you have side effects after the first shot, unless a vaccination provider or your doctor tells you not to get a second shot. After receiving your first dose, you will receive a card with your name, birth date, the vaccine you received, and the place and date you received it. Keep it in a safe place and make a photocopy or take a picture just in case you lose it. Bring the card with you when you go for your second shot. If you need help scheduling your vaccine appointment for your second shot, contact the location that set up your appointment for assistance. Both vaccines have shown to have mild to moderate side effects, including soreness or swelling on the arm where you got the shot, headache, body aches, tiredness, and fever. Side effects usually go away within 2 to 3 days and are more common after the second dose and are less common in older adults. The vaccine cannot give you COVID-19. Even after getting vaccinated, it's important to continue taking proper precautions to help us move closer to the end of the COVID-19 public health emergency. Cover your mouth and nose with a mask when around others. Stay at least 6 feet away from others, avoid crowds, and wash your hands often. Help identify and report fraudulent vaccination appointments and scams by sharing the following tips. You will never be asked to put down a deposit or provide credit card information to make a vaccination appointment in New York City. Any incidents of vaccine fraud or abuse should be reported to the New York State Attorney General by filing a complaint via ag.ny.gov/complaint forms. A hotline is also available to report vaccine abuse and fraud. New Yorkers who suspect fraud in the vaccine distribution process can call 833-VAX-SCAM or 833-829-7226 toll free, or email the State Department of Health at stopvaxfraud@health.ny.gov. Understand the benefits for workers affected by COVID-19 by visiting access.nyc.gov/coronavirus COVID-19 updates and learning more about the various programs and benefits available. The following table is available in numerous languages and in PDF format too. And that concludes the presentation. Now we'll take a few questions from the audience. Can children get the vaccine? No, children are not eligible for the vaccine at this time. I got an expensive hospital bill. How can I get help paying it? So you can go to communityhealthadvocates.org or call 888-614-5400 to seek free help from trusted community-based organizations that can help you with healthcare related bills. I'm having trouble paying my bills because of COVID-19. Where can I go for help? Yeah, so many New Yorkers are behind in rent and worried about losing their housing. If you received an eviction notice because you failed to pay rent, call 311 and ask for the tenant helpline. Um, Also, under New York State law, called the COVID-19 Emergency Eviction and Foreclosure Prevention Act, you can prevent your landlord from evicting you at least until May 1st, 2021. If because of the pandemic you lost income, have increased expenses related to health or work, you have childcare or other family care expenses, have been unable to obtain meaningful employment, can't afford to move or find a new place, or vacating and moving would pose like a significant health risk to someone 65 years or older, or has a disability or an underlying medical condition, you must sign a hardship declaration form, and the protection is available to everyone, uh, regardless of their immigration status. So you can find the hardship declaration form in English and Spanish at nycourts.gov/COVIDEFPA.SHTML. And you can call 311 again and ask for the tenant helpline to receive help from a professional to determine if you qualify for these protections and to prepare necessary documents. And they can also help you find a free housing attorney. I want to choose which vaccine I get. Can I choose when I get to the vaccination site? No, you can't, but you can select a location that has the vaccine that you prefer. So when you use the city and state vaccination sites, the type of vaccine that's offered is listed. Um, However, we recommend getting the vaccine that's available when you're eligible. So do not wait for a specific brand. All currently authorized and recommended COVID-19 vaccines are safe and effective, and one vaccine is not recommended over another. If I'm pregnant, can I get a COVID-19 vaccine? Yes. If you're pregnant, you might choose to be vaccinated. And based on how COVID-19 vaccines work, experts think they are unlikely to pose a specific risk for people who are pregnant. However, there are currently limited data on the safety of COVID-19 vaccines in pregnant people because these vaccines have not been widely studied in pregnant people. But clinical trials to evaluate the safety and efficacy of COVID-19 vaccines in pregnant people are planned. Should I get the vaccine if I already had COVID-19? Yes. And that's because experts don't know how long you're protected from getting sick again. Since it's possible to get COVID-19 again after you've recovered, it's recommended that you get vaccinated if you're eligible. Do I need to wear a mask and avoid close contact if I'm fully vaccinated? Generally, yes. For now, fully vaccinated people can gather indoors without physically distancing or wearing masks with other people who are fully vaccinated. Well, it doesn't look like there are any more questions in the chat. So I want to thank you for tuning in and helping share accurate messaging about the New York City's test and trace efforts. Our next virtual town hall will be on Thursday, June 17th, right here on Facebook Live. And please continue to download and share our Test and Trace two-pager available in Arabic, Bengali, Creole, Mandarin, Spanish, and Russian, and share accurate information on how to prevent the spread of COVID-19. To stay involved with the New York Immigration Coalition, follow us on Facebook, Instagram, and Twitter, and text NYIC to 52886 to stay up to date with our actions and campaigns. Stay safe and enjoy your evening.